It all started with a pilot program in Ifedore local government area of the state to reduce child and maternal mortality by at least 50% by the end of the year 2013 and run an integrated maternal and child care facility that will offer qualitative and critical interventions when needed. Today, Abiye, the Safe Motherhood initiative of the state government, has become the pride of the Federal Ministry of Health's policy thrust to give greater attention to maternal health. Abiye has attracted international attention, thereby giving the state government a good opportunity to showcase the model to the world. The Center for Strategic International Studies in Washington, D.C. heard about the success story and dispatched a fact-finding team to the state. The empirical evidence from beneficiaries told the story. The center invited the governor and his team to Washington, D.C., and today they're sharing their strategy.
We are seeing patients coming early because of quality of care and because of universal access, occasioned by the fact that at the point of service, it's completely free. Based on this empirical evidence, scaling up of the program became imperative. Abiye scale up in other 17 local government areas, sensitization of 500 stakeholders, registration of 20,943 pregnant women. We have also trained another set of 450 health rangers. We have distributed another set of 10,000 mobile phones for these pregnant women. We have trained 600 on our residency card program. Simply put, we have found out that almost 30% of patients in our hospitals come from outside our state. And because of free access, it means that we are bearing the burden for other states. They come from all over, from every geopolitical zone. But we have developed a multi-application residency card. If you don't have that card, you pay premium.
There is huge political commitment and will for this to happen.
The pragmatic strategies also served as a motivating factor for the team.
We thank God that we're able to cope because it's not been easy having to be able to track those pregnant women using the health rangers, equipped with mobile phone, equipped with customized checklist to do a birth plan for them, emergency preparedness and all of that, and then getting the result as stated by Mr. Governor.
We're given a mandate to run an integrated maternal and child care facility, fully poised to offer qualitative and critical interventions where required. We served as the apex referral center for the Abiye Safe Motherhood program. That is, for once, we had a facility that's able to handle a majority of the complications associated with pregnancy and medical illnesses in children, 100% free of charge. So right now, in less than 3 years, we are about the busiest maternity center in the whole of Nigeria.
That must be quite challenging.
Oh yes, it is, but I must tell you, the governor deserves a lot of kudos because he has given us the political will and the muscle to drive us to that success story. And I dare say that in less than 3 years, we've been able to safely deliver more than 16,000 women. And now we average about 25 deliveries every day, which again is making us the busiest maternity center. But more importantly, we're about the only facility in Nigeria that caters for pregnant women and children, irrespective of their social status, irrespective of their ethnicity, irrespective of their location where they reside. We don't discriminate. Why do we have to do this? It's just because we have to prove a point that expending money on the care of women and children is actually more of an investment on the socio-economic well-being of Ondo State.
My responsibility is to create linkages that will help with the development of Ondo State. And when you have a leader who is passionate about something that's beneficial to the community and to the citizenry, you can't help but to leverage your contacts and your sphere of influence. As a state, we have a lot of developmental projects. I am hoping that with being able to sell our brand as a state, we'll have technical partners, we'll have partners that will fund projects, so we can scale up whatever we are doing and even model it within Africa.
Abiye is the Yoruba literal translation of Safe Motherhood. In Washington, D.C., I'm Joy Usiago, NTA News.